Stop scrolling. Don't move. As a doctor, I need you to hear this before anything else. Because what I'm about to tell you has made the difference between life and tragedy in real cases I've seen. I've watched patients ignore very small warning signs during pregnancy, thinking it was normal, thinking they had time, and then arrive when it was almost too late. And that's exactly why this video exists. If you are pregnant right now or someone you love is expecting, this could save a life. Don't ignore this. Your body may already be warning you in ways you don't understand yet. Because here's the truth, most people never get told. Pregnancy doesn't always shout danger. Sometimes it whispers it. And if you miss those whispers, the consequences can become serious very quickly. What I'm about to tell you are the warning signs that doctors take extremely seriously, but many people dismiss at home. And I need you to stay with me until the end, because one of these signs is something most people think is normal until it isn't. What I'm about to tell you is something many regret not knowing sooner. So before you scroll away, give me just a few minutes of your attention, because your body might already be trying to tell you something important right now. Don't assume it's nothing. Listen closely. This matters more than you think. Your next few minutes could change everything. Most people miss this completely. I'm a doctor, and over the years, I've seen the same mistake happen again and again during pregnancy. Not once, not twice, but repeatedly. And what's always surprising is that it starts the same way. Small symptoms that don't seem alarming at first. A little discomfort, a mild headache, some fatigue. Things most people assume are just part of pregnancy. But in medicine, we learn something very important early on. Serious conditions rarely begin loudly. They begin quietly. That's why I'm speaking to you calmly right now, not to scare you, but to make sure you don't miss what your body may already be signaling. Because most people don't realize these signs are serious until they've already escalated. And I've seen what happens when that delay costs precious time. Let me walk you through what your body is trying to tell you in a way that's simple, clear, and based on what we actually look for in real clinical settings. This is not fear. This is awareness. And awareness is what prevents emergencies. During pregnancy, your body changes rapidly. That means certain warning signs can look harmless on the surface, but actually point to something that needs attention. And I want you to stay with me, because in a moment, I'm going to show you the exact warning signs doctors are trained to never ignore. The ones that often get dismissed at home until they become urgent. Some of them may surprise you. One of them, in particular, is commonly misunderstood, so don't rush ahead, because what comes next could help you recognize something important early, when it still matters most. Warning sign number 1, severe bleeding or pain. Let's start with the first warning sign, and I need you to listen very carefully. If you experience heavy bleeding or sharp abdominal pain, do not wait. Not see how it feels in an hour. Not rest and hope it improves. Not maybe it's normal. Because in pregnancy, bleeding or strong abdominal pain is not something to monitor casually. It is something that requires immediate attention. Now, I want to be clear, some mild discomfort can be normal, but what I'm talking about here is different. This is bleeding that feels unusual for your body, or pain that is sharp, persistent, or getting worse instead of better. This is your body sending an urgent signal. And one of the most dangerous mistakes I've seen is people trying to wait it out because they don't want to overreact. They tell themselves it's probably nothing serious, or they don't want to go to the hospital unnecessarily. But in medicine, we always prefer one thing: checking early rather than arriving late. I've seen people dismiss this and regret it deeply, because when bleeding or severe pain is connected to a complication, time matters. Delays can turn something manageable into something far more serious. Never assume it will go away on its own. That's one of the most important lessons I can give you today. If your body is showing this kind of sign, it's not asking for observation. It's asking for action. And I want you to remember this as we move forward. Pregnancy symptoms should not leave you guessing when it comes to severity. If something feels wrong in a strong or sudden way, it deserves attention immediately. In the next warning sign, I'll show you something even more commonly ignored, because it doesn't always feel painful, but it can still be very important. Warning sign number 2, severe headaches or vision changes. Now let's talk about the second warning sign. And this one is often misunderstood because it can start in a way that feels ordinary. A headache that doesn't feel normal or blurred vision is not something to ignore. In fact, many people try to push through it. They think it's stress, dehydration, lack of sleep, or just the usual discomfort of pregnancy. But there is a difference between a mild, occasional headache and a persistent or intense one that feels different from what you normally experience. This is not a regular pregnancy symptom, and when vision changes are added, like blurriness, seeing spots, or sudden difficulty focusing, that combination becomes even more important to take seriously. Without going too deep into medical complexity, these symptoms can sometimes reflect changes in the body's internal pressure systems, and during pregnancy, those changes should always be watched carefully. Your body is signaling pressure changes, and the key mistake I see is people normalizing it too quickly. They rest, drink water, maybe take a break, but they don't recognize when the pattern is different from their usual headaches. Listen carefully. This matters. Because in clinical practice, one of the most important questions we ask is not just, do you have a headache? But is this headache different from your normal ones? That difference is critical. If something feels unusual, stronger than expected, or paired with vision changes, it should not be dismissed or delayed. I've seen cases where early attention made all the difference, simply because someone didn't ignore that change. And I want you to remember, pregnancy is a time where small signals can carry meaning. Your job is not to guess, it's to pay attention. In the next section, I'll show you another warning sign that doesn't always involve pain, but can be just as important to recognize early. Warning sign number 3, decreased baby movement. Now I want to talk about something very important and very emotional for most expectant parents. If your baby's movement suddenly slows or stops, this is critical. Every pregnancy is different, and movement patterns can vary depending on the stage. But what matters most is your personal baseline, what is normal for your baby. Because over time, you begin to recognize patterns, when your baby is active, when they rest, and how they usually respond during the day. And that's why any noticeable change in that pattern deserves attention. Some people try to reassure themselves. They say, maybe the baby is just sleeping, or maybe I'm overthinking it. But I want you to pause on that thought for a moment. Trust what you feel. It's important. Your awareness is not something to dismiss. In fact, in clinical settings, we often encourage parents to pay attention precisely because they are the first to notice subtle changes. And one of the most common delays we see is waiting too long to see if it improves. Never wait to see if it improves, because time matters when it comes to changes in movement. Early attention allows for proper evaluation and reassurance, or action if needed. Early action makes all the difference. I've seen situations where people hesitated simply because they didn't want to worry unnecessarily. But in healthcare, we always prefer caution when something feels different from normal. Your instincts matter more than doubt in moments like this. So if something feels off, if movement is clearly less than usual, don't second-guess yourself. Reach out and get checked. In the next warning sign, I'm going to talk about something that affects the whole body at once and is often mistaken for simple tiredness or normal discomfort, but can sometimes signal something more serious. Warning sign, urine number 4, swelling or shortness of breath. Now let's talk about another warning sign that people often underestimate because it can feel like normal pregnancy changes. Swelling in the face, hands, or sudden breathing difficulty can signal serious complications. During pregnancy, mild swelling in the feet or ankles can sometimes happen, especially after standing for long periods. But what I'm referring to here is different. Swelling that appears suddenly, becomes noticeable in the face or hands, or seems to worsen quickly without a clear reason. And even more important is shortness of breath that feels unusual. Not the mild breathlessness you might expect later in pregnancy, but a feeling that you cannot catch your breath properly even when resting. This is not just discomfort. It can be serious. Because your body is working harder during pregnancy, changes in circulation and oxygen flow need to be monitored closely. When something disrupts that balance, your body often shows signs before things become more severe. Your body is under stress when this happens, and one of the most dangerous patterns I've seen is when people normalize these symptoms. They assume swelling is just part of pregnancy, or they think breathing changes are simply due to weight or pressure. But normalization can delay important care. Don't normalize this symptom. If swelling appears suddenly, especially in the face or hands, or if breathing feels noticeably harder than usual, that is a signal that should be taken seriously and checked promptly. I always tell patients pregnancy changes are expected, but sudden changes are not something to ignore. You don't need to panic, but you do need to pay attention. Because early awareness allows for early evaluation, and early evaluation is what keeps situations from escalating. In the next warning sign, I'll explain something that can start as a simple fever or feeling unwell. But in pregnancy, it deserves closer attention than most people realize. Warning. Sign number 5, high fever or infection signs. Now, I want to talk about something that often starts quietly, but can change quickly if it's ignored. A high fever during pregnancy should never be ignored. Many people are used to thinking of fever as something minor, something that comes with a cold or mild infection and goes away with rest. But during pregnancy, your body is in a more sensitive state, and infections don't always behave the same way they do outside of pregnancy. Your immune system is naturally adjusted during this time, which means your body may not respond in the same predictable way it normally would. And because of that, infections can sometimes progress faster than expected. Infections can escalate faster than you think. What begins as just feeling unwell can sometimes develop into something more significant if it's not assessed early. That's why fever should always be taken seriously, especially if it is high, persistent, or comes with other symptoms like chills, body aches, unusual fatigue, or general weakness. This is a moment to act, not wait. One of the most common mistakes I see is waiting too long, hoping the fever will break on its own, or assuming it's just a minor illness. But in pregnancy, it's always better to be cautious and get evaluated early rather than delay and risk complications. Early care protects both mother and baby. That's the key principle I want you to remember here. It's not about panic, it's about timely action. Because when infections are identified early, they are usually much easier to manage. But when they are ignored, they can become more complicated than they need to be. So if you notice a significant fever during pregnancy, don't dismiss it. Don't wait it out. Get checked. Your body is communicating with you in real time, and paying attention is one of the most important things you can do. In the next section, I'll explain another warning sign that is often overlooked because it can feel like general exhaustion. But there is a point where fatigue becomes something more important to pay attention to. Warning sign number 6, severe nausea, dehydration, or weakness. Now let's talk about a warning sign that many people underestimate because it often starts gradually. If you cannot keep fluids down or feel extreme weakness, this is a warning sign. Nausea is common in pregnancy, especially in the early stages. Many people expect it, and in mild forms, it can be considered part of the normal experience. But there is a clear difference between typical nausea and a situation where your body is no longer able to maintain balance. When you are vomiting repeatedly, unable to keep even water down, or feeling increasingly weak throughout the day, your body is signaling that it is struggling to maintain hydration and energy levels. And that matters more than most people realize, because hydration and nutrient balance are essential not only for your well-being, but also for supporting your body through pregnancy. Your body needs support immediately. One of the biggest risks in these situations is waiting too long, thinking it will pass on its own. But when fluids and nutrition are not being retained, the condition can worsen gradually without obvious warning until it becomes more severe. Don't wait until it becomes worse. I've seen many cases where early intervention made recovery much easier simply because action was taken before dehydration became significant. And this is important. Weakness is not just being tired. When it becomes intense, persistent, or paired with inability to eat or drink properly, it is no longer something to ignore. Small signs can escalate quickly. That is something I want you to remember clearly. What begins as mild discomfort can progress if the body is not supported in time. So if you find yourself unable to keep fluids down or feeling unusually drained compared to your normal pregnancy fatigue, it is important to take that seriously and seek guidance. Because early support can make a major difference in restoring balance before things become more difficult. In the final section, I'll guide you through exactly what to do if you notice any of these warning signs, and how to respond calmly but correctly in real time. What to do immediately. Clear action steps. Now I want to bring everything together and focus on something very important. What you should actually do if you notice any of these warning signs. If you notice any of these signs, contact a healthcare provider immediately. Not later, not after monitoring it for days, not after trying multiple home remedies or waiting to see if it settles on its own. In medicine, timing matters, and during pregnancy, it matters even more. So I want you to keep this simple framework in mind. First, don't try to diagnose yourself. It's very easy to underestimate or overthink symptoms when you're at home. What feels mild to you may be significant in a clinical context, and what feels alarming may turn out to be harmless. But the only way to know is through proper evaluation. Act early, not late. Second, trust escalation patterns. If a symptom is getting worse instead of better, that change itself is important information. Your body communicates through patterns, not single moments. When in doubt, get checked. That is not an overreaction. That is responsible care. One of the most important principles in pregnancy care is that uncertainty should be resolved early, not ignored. Third, don't wait for multiple symptoms to appear together. One strong warning sign is enough reason to seek advice. You don't need a combination of symptoms to justify attention. And finally, remember this clearly. You are not bothering anyone by asking questions about your health. That is exactly what healthcare systems are there for. Your safety comes first, always. I've seen too many situations where hesitation caused unnecessary delays, and I don't want that for you. So take this seriously, stay aware of your body, and act promptly when something feels wrong. In the final step, I'm going to close this video with an important message about why this awareness matters, and I'll ask you something that can help improve this information for others watching as well. I've shared these signs because I've seen what happens when they're ignored. Not in theory, not from textbooks, but in real situations where small warning signs were dismissed at home, assumed to be normal, or delayed until it became urgent to act. And I don't say this to create fear. I say it because awareness changes outcomes. As a doctor, one of the hardest things to witness is when someone says, "I thought it would go away," or "I didn't think it was serious," after the fact. That's why recognizing these early signals matters so much. Because pregnancy is not just about waiting, it's about observing, responding, and acting when your body communicates something different. If this helped you, don't keep it to yourself. Information like this is only powerful when it reaches the people who need it. Share it with someone who is pregnant, planning to be, or supporting someone who is. Someone close to you may need this today. And even if it doesn't apply to you right now, it may help you recognize something important in the future, or help someone you care about make a timely decision. Awareness saves lives. That is not an exaggeration. It is something I have seen repeatedly in practice. The earlier someone responds to warning signs, the better the outcome tends to be. Now I want your feedback. Were these direct messages clear and strong enough for you to understand the urgency? Or would you like them made even simpler or more powerful? Because improving how this information is delivered can help more people recognize these signs faster, and that is the goal of everything you've just watched. If you found this video helpful, please share it with your friends and family and leave a comment to tell me what you learned. Your support goes a long way in spreading the message and growing this community. Thank you, and see you soon.